Hi, I'm Dr. Tony Barcelona, and we're here at West Niagara Chiropractic and Wellness Center. Today I'm going to talk about growing pains in children. We're going to concentrate on the growing pains that give you the muscles tension and the joints for today. So first what we do is find out where the child is experiencing this pain, and mostly we find it at the bottom of the kneecap and through here. They'll say they feel a deep achiness underneath here or even above it for the muscles here. So first what we do is we check their posture, turn them to the side a little bit for the cameras here, and we check their shoulder height, their ears are level. If there's any winging on the back of the shoulder here, the scapula, of course the scoliosis, hip height, knees, and their feet if they're falling in or out, pronating or supinating. Once we've determined that's all okay, we'll turn you back over here, Colin. We determine if there's any injuries to the knee or any problems that would have caused this type of symptoms that they're having. So we've determined that it is growing pains as a sense of muscles being tight. And what happens is that you have tight muscles in through here that come down and attach and wrap around like this. But they pull on this patella bone here, and it causes this little ligament about an inch long here to get really stretched up. And what happens there is that's where they get all the pain. So simply put, we just have to stretch these muscles out and get them to release, and that takes the tension off the knee. I'm going to have you lay on your back on the table here. I'll show them what we're talking about here. Very good. So once we've assessed that there is no injuries or anything like that, and that it is just more of a tight muscle, what's happening is the bone usually grows at a faster rate than the muscles can actually stretch. And so the muscles become a little tighter on the ends. So we just got to get the muscles to stretch out a little bit, and it takes the stress off both ends, especially this end here. A lot of times you'll see it more in kids that are active in activities or in sports or anything like that, because their muscles are a little bit more tighter in those circumstances. So what we do is we just move the joint back and forth, and then we do a little technique. The technique that I use the most is active release technique for this, and it works the best, and it's the fastest recovery. And what that is making a little bit of a contact on the muscle and just stretching back and forth. Yeah. And basically just stretching out the muscles and relaxing any knots or trigger points that are in the muscles. And we work around the whole muscle and open it up. If it is tight, we can put a little machine on there, a little tens or low volt to relax the muscles that way. And then what we'll do is go over some stretching with the child and exercises to help it out. Okay? Come on up, Colin. So if you feel that you have a problem or your child has a problem with growing pains, please give us a call at West Niagara Chiropractic and Wellness Center. We'll do a full evaluation, see if that is the problem, and we'll do our best to get you up and running as quickly as possible.